On the 26th of February, 2025, actor Gene Hackman and his wife, Betsy Arakawa, were both found dead in their Santa Fe home by a pair of maintenance workers who saw one of their bodies through the window and immediately called the police. While Hackman had been in poor health for quite some time, his wife, almost 30 years younger than him, was thought to have been doing fairly well. The Santa Fe Police Department immediately opened an investigation, looking for any signs of foul play. Tragically, it appeared that they had likely died at least a week prior, with Arakawa passing first and her husband following several days later, evidently unable to call for help due to his very poor state of health. Except for an open bottle of pills, there appeared to be no clues as to the cause of death of the pair. This would change almost a week later, though, when the results of the autopsy were made public. Hackman, the report had concluded, had died primarily of cardiovascular disease, which was not to be unexpected given his advanced age. His wife, however, appeared to have died of an obscure rat-borne illness known as Hantavirus pulmonary syndrome. In today's episode, we will try to answer several questions. First of all, what exactly is Hantavirus pulmonary syndrome? Second, where did this little microbe come from? And third, should you be worried about a potential outbreak of this mysterious and terrifying disease? Early in the morning, on May 14, 1993, a teenage Native American man was driving with his family through a rural part of New Mexico when he started to feel short of breath. He was extraordinarily healthy at baseline, being a competitive marathon runner, but had started to feel somewhat unwell several days prior and had visited a doctor who diagnosed him with an upper respiratory infection. After a few days of rest, though, he felt well enough to go on a family trip to Gallup, New Mexico, which was just a few hours' drive from his hometown of Crown Point. As he tried to cough up whatever was in his chest, he noticed that each breath was becoming more and more difficult. After several minutes, his family became worried enough that they pulled over to a gas station to try to call for help. By this point, the young man was gasping for air, desperately trying to pull enough oxygen into his lungs. By the time the ambulance arrived, though, he was already unconscious and starting to turn blue. The ambulance rushed him to the nearest emergency room, where doctors found his lungs to be filled with fluid, a condition known as pulmonary edema. Despite their best efforts, the teenage boy tragically succumbed to his illness. Naturally, the doctors were left bewildered. How was it possible that such a young, healthy man could have died so quickly from what looked like just a simple respiratory infection? They quickly called the local medical examiner's office and gave them the details. Later that day, a young medical examiner by the name of Richard Malone was dispatched to the hospital to investigate. After hearing the story, Malone immediately remembered another death that he had investigated several weeks prior, also in a young Native American who had died suddenly from a mysterious case of pulmonary edema. Despite a thorough investigation at the time, he had been unable to determine the cause of death. Now, worried that he was dealing with an outbreak of a new and terrible illness, he reluctantly approached the family of the deceased teenager to request an autopsy. He expected that his chances of getting permission were quite small, though, as the Navajo people had historically been generally reluctant to do anything that could be considered to be disturbing the body of the recently dead. What he found, though, when he spoke with his family, shook him to his core. Apparently, they had been on their way to attend the funeral of the teenage boy's fiancée, who had also suddenly died several days prior. As she had died at a small Navajo Nation clinic, her death had not been reported to the New Mexico Health Department. Now, Malone knew that he was dealing with a full-blown outbreak of an unknown and highly lethal illness. As expected, the family did not want an autopsy. Tragically, though, the recently deceased couple had left behind an infant son, and Malone was able to convince the family to agree to the autopsy in order to protect his health. After preparing the bodies to be sent off to the state laboratory, Malone called the medical director of the clinic where the young man's fiancée had died, Dr. Bruce Tempest. Dr. Tempest recalled at least 2 other recent cases reported to him of young people suddenly dying of pulmonary edema. Together, the pair contacted as many other physicians in the region as possible and found several more cases throughout the area. Unfortunately, the press soon caught wind and reported that an unknown illness was killing young Native Americans in the area. This almost immediately whipped the whole region into a full-blown panic. Soon, Native Americans, primarily from the Navajo and the Hopi people, were forbidden from regional athletic events, they were shunned, and they were generally made to feel unwelcome in public areas. Despite several autopsies and a thorough investigation, Malone and other investigators at the New Mexico Health Department were completely unable to find a cause for all of the deaths. For unclear reasons, though, they delayed contacting the Center for Disease Control, the CDC, for 2 weeks. After they finally reached out, though, the CDC mobilized a team of experts to investigate. Impressively, these experts were on the ground in New Mexico within 24 hours. They immediately set up a command center where they planned to evaluate any patients who experienced suspicious symptoms. Over the next several days, they examined over 30 suspected cases. Despite this, they still had no idea what they were working with. Among several other things, they suspected anthrax, tularemia, and even bubonic plague. But they found no evidence for any of these. Ultimately, they had 3 ideas. First, they thought it might be a new and highly lethal version of the flu. Second, they suspected a possible environmental toxin, given the region's history of military weapons testing. The third and most concerning was that they were dealing with a completely new and very lethal pathogen. By Friday, June 4th, just 3 weeks after they had first identified the cases, they had their answer. From 9 patients, they had been able to extract antibodies to an obscure pathogen belonging to the Hantavirus family. So, what exactly is Hantavirus? Well, it's a somewhat obscure family of viruses that scientists have been aware of since the 1950s, when United Nations soldiers stationed near the Hantan River during the Korean War became infected. It's naturally found primarily in rodents and transmitted mainly through their urine and their feces. It infects humans typically when food becomes contaminated, or when a person is bitten or scratched by a rodent. Historically, it's been located almost exclusively in Europe, Africa, and Asia, and was, at least until this New Mexico outbreak, only known to cause a single form of disease, known as hemorrhagic fever with renal syndrome. In this disease, patients typically experience headaches, nausea, vomiting, and diarrhea in the early stages. As the disease progresses, it interferes with the body's ability to form clots, leading to bleeding into the digestive tract, the lungs, and the kidneys. It even causes small bruises, known as petechiae, to form on the skin. The virus also makes blood vessels much more permeable to liquids, causing a massive fluid loss from the blood and leading to dangerously low blood pressures. Soon, the kidneys will likely begin to fail, producing dark, reddish urine. Over time, though, the body will hopefully fight the virus off, but typically up to 15% of those infected will ultimately die of the disease. Globally, over 100,000 people annually are affected, with most cases occurring in China. Hantavirus is not just one virus, though. It's a collection of a whole host of related viruses. The hemorrhagic fever with renal syndrome is caused by 4 separate hantaviruses in and of itself. These include the Hantavirus, the Sol virus, the Pumala virus, and the Dubrava Belgrade virus. But now, it appeared that there was a new strain out in the wild. Returning to our investigation in New Mexico, investigators were baffled. Never before had a hantavirus caused such severe pulmonary symptoms. Not only that, but this new version appeared to be far deadlier. While the hemorrhagic fever with renal syndrome version had killed only between about 1 and 15% of those infected, this new pulmonary variant killed a staggering 30 to 60% of those infected. Like its old world cousins, it caused blood vessels to become leaky. Only this variant appeared to particularly target the lungs, and its effects were devastating. The CDC worked feverishly to identify the source of the disease, terrified of the potential consequences of a large-scale outbreak. Impressively, it took them less than 3 weeks to definitively identify the virus, and identify the deer mouse as its primary source. Once they isolated the virus, the CDC recommended naming it the Muerto Canyon virus, after one of the worst affected areas on the Navajo reservation. The Navajo, however, appealed to the CDC to rename the virus, as their people had already experienced a great deal of prejudice regarding this disease. Ultimately, the CDC chose to officially name it the Sin Nombre virus. Its translation in English, the virus with no name. So why had this virus cropped up seemingly out of nowhere? The virus had evidently infected deer mice prior to the spring of 1993, but had not been transmitted to humans in anywhere near large enough numbers to raise any real red flags. An investigation eventually uncovered that in the previous winter, the El Niño had hit, resulting in much more rainfall than usual. This led to an abnormal abundance of vegetation in the region, resulting in an explosion of the deer mouse population. In the spring of 1993, the deer mouse population was found to be 10 times larger than in the previous year. Such a large growth in the vector for hantavirus inevitably led to its spread into humans. Fortunately, though, it appeared that humans were unable to spread the virus to one another, so the disease remained limited to those in close contact with deer mice. Unlike previously known versions of the virus, this one was spread primarily when mouse urine or droppings are somehow kicked up into the air and inhaled into the lungs. So where does that leave us now? After the New Mexico outbreak, the disease once again became exceedingly rare. In the decades since, less than 800 cases have been reported, and annual cases fluctuate in line with the overall size of the deer mouse population. But, as with the case of Gene Hackman's wife, Betsy Arakawa, it does still occur and can kill suddenly and very unexpectedly. Even with modern, improved understanding of the disease, treatment is still very difficult. Over the years, physicians have tried a number of different treatments, including fluid therapy, vasoconstrictors, steroids, and many others, to no avail. One strategy that seems to be effective, though, if it can be implemented in time, is a procedure called extracorporeal membrane oxygenation. It's also known more commonly as ECMO, or the heart-lung machine. In patients whose lungs have been overwhelmed by the virus, they can be placed on this machine for several days to weeks, buying their immune system time to fight off the invader. This treatment struggled to gain traction at first, as patients often deteriorated extremely quickly, not leaving anywhere near enough time for doctors to perform the procedure to hook the patient up to the machine. This left many patients experiencing what's called a crash ECMO, where doctors frantically connect the patient to the heart-lung machine while simultaneously performing CPR on a patient whose heart has stopped beating. Thanks to the research at the University of New Mexico, however, patients are now typically prepared for ECMO as soon as they're diagnosed with the virus, so that the machine can be quickly turned on if they show signs of deterioration. With this, survival rates can approach 80%. But without early recognition and intervention, hantavirus is still capable of producing sudden and devastating consequences.